But ultimately, what's really going to be the focus in a vaginal rejuvenation is mostly going to be the labia itself and kind of re-tightening the area or recontouring the area to give it a certain look that a woman might be seeking. Some women, even if they haven't had children, may want to alter or improve the appearance of their genital area, and that's where a plastic surgeon comes into play. One of the more common techniques used for vaginoplasty is going to be what's called an excision, usually of the labia minora or the labia majora. All right, welcome back everyone. I'm Dr. Sean, a Beverly Hills plastic surgeon, and for today's topic, I want to educate you on vaginoplasty. Yes, you heard that correctly. It's literally any kind of adjusting procedure done to the vaginal complex or the vulvar complex in women. Now, typically people think about childbirth and then it affecting how the vaginal aesthetic looks, so therefore that's why women want to come get rejuvenation done. But it's not exclusively for women who have had children and specifically vaginal births. There are obviously, like with any part of the human body, variations that exist in the aesthetic of individuals' vulvas and vaginas. So that's why some women, even if they haven't had children, may want to alter or improve the appearance of their genital area, and that's where a plastic surgeon comes into play. One of the more common techniques used for vaginoplasty is going to be what's called an excision, usually of the labia minora or the labia majora. Now, if you know the vaginal anatomy, you'll know that there is the outer area, which is called the labia majora. Then there is the inner area called the labia minora. And then that's where then you have what's called the introitus, which actually leads to the vaginal canal. But ultimately, what's really going to be the focus in a vaginal rejuvenation is mostly going to be the labia itself and kind of for lack of a better term, re-tightening the area or recontouring the area to give it a certain look that a woman might be seeking. Now, the way that this is done, usually it's going to be that the skin is actually just kind of cut out in a wedge format. So it's literally for lack of a better term, chopped off. And then what happens is that is sewed together and then reduced in size. So that way you don't have necessarily uneven or asymmetrical labia from one side to the other. Other women also have things such as excess labial show, which means that the labia, especially the minora, might be actually hanging out, causing almost an aesthetic deformity that a lot of women don't like to have. So that's a big reason why they may get it. And then it is true that through childbirth, especially if you have something called an episiotomy during childbirth, which is where a nick, a cut, has to be made, usually in the direction from the vagina to the anus in order to aid in the delivery of the child, that sometimes women after that will want vaginal reconstruction in order to reestablish the aesthetic that they had before surgery, before they had the child. Now, there are some more aggressive procedures out there that can be done. I don't personally do them, but I know a big topic of conversation in media has been the surgery known as re-virginization. And that's where essentially women will go get a procedure done, usually with some type of skin graft or a small rearrangement surgery to actually re-establish the hymen that exists in the vaginal introitus. I don't personally offer that because I don't see a ton of utility for it. And then also the truth is that even with a skin graft, although it may look like you have a hymen, the reality is through intercourse, you're most likely just going to end up tearing through it again. So it doesn't really have a ton of purpose for me to do it for you, especially since it can be a painful operation. But that is what that whole procedure was about if you have heard about it in the media. But at the end of the day, it's your genitals, it's your choice, whatever you want to do with them, as long as it's safe and I feel comfortable doing them on you because you're healthy and making this decision for you and nobody else, then I'm happy to have that conversation with you. I think it's very reasonable to want to have a refreshed vaginal area, to feel, confident in every part of yourself, even if it's not an area that people are seeing very often. And if they are seeing it very often, more power to you. So if vaginal rejuvenation is something you're interested in or want to see if you'd be a good candidate for, go ahead and contact my office. Let's talk about it, let's have a discussion, and let's get on the same page. Yeah, that's my lesson on vaginal rejuvenation for today. Again, I'm Dr. Saadat, a Beverly Hills plastic surgeon. Make sure you like, share, and subscribe to my page, and then tune in next week to see what topic we discuss then. Bye.